Recording. So we'll go ahead and get started with our roll call. We'll start off with our hospitals, starting off with Anderson Hospital. Anderson, are you on? I don't see Eric logged in. Okay. Alton Memorial.
Good morning, Philip. It's Brian for Alton.
All right. Thanks, Brian. Boyd. Trying to see if I see Nancy logged in. I do not see Nancy this morning. Okay. Carlinville Area Hospital. How about Staunton? Okay. Fayette. No one from Fayette. Gateway.
Gateway's on, Rick and Danielle.
I see you. Thanks, Rick and Danielle. Appreciate it. All right, HSHS Holy Family. St. Elizabeth's. St. Joseph's Breeze. And St. Joseph Highland. Okay, Jersey Community Hospital. From Belleville, obviously you have myself, you have Lee, Eric, and Scott Klosterman. We're all on this morning. That counts for Shiloh as well. Chester.
Georgia's here.
Thanks, Georgia. OSF St. Anthony's.
OSF's here.
Gotcha. Who was that? I just saw it pop up.
This is Dennis Stanford.
Hey, gotcha, Dennis. Welcome. Thank you. Redbud. I don't see Tara on. Diane, okay. Sparta. And Touche.
I am present.
I see you, Eric. Thank you very much. A little light from our hospitals today, but we'll press forward. All right, let's go to our health departments. Starting off with Bonner County.
Terry, I'm here.
Morning, Terry. Calhoun County. Clinton County.
This is Trisha, I'm here.
Gotcha, Trisha. Thank you. Anyone from Eastside Health District? Fayette County Health Department. Greene County Health Department.
This is Molly. I'm here.
Gotcha, Molly. Thank you. Jersey. Macoupin County. Madison County. Monroe County.
Vicky here.
Good morning, Vicky. Randolph County. Last but not least, St. Clair County. Let's see. Mila, you are unmuted. Okay, I got you there. You were unmuted. I didn't hear you, but I saw you pop open and I did hear some background. So I see you there. And who was that? Was that Mila? Gary Engel said, can't hear you. Anyone else having any audio issues? Does anything sound garbled or is it? No? Okay.
Loud and clear.
Normal.
Okay. Let's go to Greg Atterbury, RMSC.
I am on.
Thank you, Greg. Beth Busman, ERC.
She's out for a couple of weeks.
Okay, thanks, Greg. Our BJC partners, I think I saw Sean on. Anyone else? BJC, Sean, are you on?
I'm here, Phil.
Thanks, sir. Appreciate it. Any emergency management agency folks? All right. Let's go over to our EMS services, MedStar ambulance. Abbott. No one from Abbott. Okay. I know we what other EMS agencies we have on here? I know Kim's on.
Yes, I'm on from Columbia.
Yep. Any other EMS agencies?
I thought I saw Jeremy Gosheimer on.
Yep.
I do see Jeremy.
Yeah, I'm on with Muscuda.
Thank you, Jeremy. Appreciate it. All right. Anyone from SLU? And Derek, I do see you, Maricopa County, LHD. Thank you very much. Any of our Scott Air Force Base partners on? And the good folks from STARS. Any of the folks from STARS on? No Dale today? Okay. All right. Anyone that I missed that would like to go ahead and sound off so we can get you recorded for attendance?
Yeah, this is Gary from St. Anthony's. I can hear now. I couldn't hear earlier.
Okay, got you, Gary. Thank you so much.
This is Mila. Can you guys hear us?
From Boyd.
Yep, Mila gotcha, and Nancy Wallen-Weber from Boyd. Got you both. Okay, thank you very much. Anyone else? All right. Well, we'll go ahead and get started. Ashley, I saw you flash up.
Sorry,
Okay.
I was just waiting for you to stop. Sorry, I'm on. Join plate.
Thank you very much. No problem. All right. Well, we'll go ahead and get started. We'll do a quick update, COVID-19 update. Then we'll go through our traditional order of business, and then we'll move forward with a few new items today. This is what the region is looking like. I mean, most of you guys are taking a look at the public link that's out there that we have, but that's what the curve is starting to look like. We have kind of flattened out here over the last couple weeks. A few peaks and valleys there. I'm hoping we can drop down a little bit further. I think today or yesterday we had 35 COVID positives and PUIs across the entire region. I'm hoping today is a little lower because for the first time, and I don't know how long, we only have here at Belleville, our census is high, or it has been high all week, but we only have one COVID positive patient today. That was as of this morning, and that's almost unheard of for us, and that's good. But I do see that we still have some folks having 5, 6, 7 at a time at their hospitals. So while we are trending down, we have kind of flattened out. Hopefully we can break below that next little barrier. So great work for everybody out there. As far as the data, as far as regional positivity data, we are at, hold on, I just see a note. I apologize. Let me pause for a quick second. I saw a note. Okay, gotcha, Gary. Thank you. As far as regional positivity data, we are at 2.9% across the region. We held at 2.5% for quite some time, which was great, but we have popped up just slightly over the last few days. And again, that's a 7-day rolling average at 2.9%. So very good. Hopefully we can stay in the 2 range. Once we broke that from the 3s, things have looked great. As far as ICU bed availability, we're right around 36%. Another good metric for us here across the region. And as you guys can see, that last one, it says 9 days of COVID patient decreases, and that's been very, very well. So it's been at a slight downtick, not as steep as it was earlier, but great data nonetheless. As far as vaccine data across the region, we're about 30% fully vaccinated. So 1 in 3, as you're walking around at Walmart picking up your grapes or those apples that Kim likes to munch on, we're about 30%, 1 in 3 folks are fully vaccinated. Great, great news. Some really standout work going across the region. The good folks in Monroe County really taking it, to COVID, getting 37.64% of their population vaccinated. Great work, guys. We've got a lot of great work here on the board. We are right in line. We were leading, I will say, the state, but we're right along. We're just a little above the state overall, but we're right there with everybody else. There are a few counties that are struggling just a little bit, but they're trying to get it going now, and they've opened up more vaccine clinics across the region. So I'm sure that they'll catch up. So great work out there on the vaccine front. And as a quick note with regard to vaccines, so I know some of the health departments are probably not on today because maybe they're already traveling down here. We will have 6 of the health departments coming to pick up vaccines today. So me and my team will be down here at our dock helping those folks out. That will be like I think we've done 3 in the last 5 weeks, maybe 6 weeks, 3 redistributions. So I'm glad to see that that's going on. One of the things I will say about vaccine, we talked about vaccine hesitancy for a while. One thing that we are noticing is that on our last round of second dose clinics, and I'm just speaking here at Memorial, and I would like to get some feedback from everybody who's on the line. But what we have noticed is that we're starting to see a decline in those coming back for their second shot. Now, we have done some, basic investigation to see, through iCare to see if some of those folks are maybe receiving that somewhere else. It's not conclusive as of yet, but the state, and Greg, maybe you could talk to this, or maybe Mila or anyone from health department could talk to this. We've had folks who may have received the vaccine get an update from IDPH, a letter from IDPH stating, we noticed that you haven't got your second vaccine, or your second vaccine's coming up. We noticed that you haven't got it, or you're within that window to still get it. Please go out and get those vaccines. So we're not sure if they are just getting their second vaccine directly somewhere else, or they're just foregoing their second vaccine. We're not 100% sure on that. So I wanted to punt it over to the good folks at IDPH, to some of our local health departments, to say, do you guys have any updates on that? Are you guys seeing that as we move forward with a lot of second doses? So Greg, I'll toss to you. I wasn't on the call on Monday because I was out. So have you heard anything like that?
Yeah, and you're exactly right. We don't know if it's people are getting their second shot somewhere else. I know they're concentrating on ideas of, as Andrew said, that's kind of our next phase of this, is getting both those people who have not gotten their second shot and those vaccine hesitant folks. So I don't have a lot of that. I will say that I did get text messages from St. Clair, so their system, it really works well for those of us who are wired to our cell phones. I got a text message reminding me both of my second dose, and I even got a text after that asking if I, once again, to remind me even after I got my second dose. So their system, their electronic system, is working good. It's just a question of those people who aren't hooked up electronically. But I know it is on IDPH's radar.
So this is Mylan. And Greg, I don't know, did they say 8% weren't coming back for their second dose? Was that on Monday's meeting? I know I heard that statistic somewhere.
I heard statistics, but I can't remember what exactly it was.
Okay. I think they're saying around 8%. And I know IDPH is also working on trying to get information from Missouri as far as like our St. Clair County residents who are receiving vaccine on that side of the river. So I think that will be an interesting component to kind of put together the statistical picture for us on, where people are going. That being said, and Phil has already said, to St. Clair County residents, we've administered over 174,000 doses. Conversely, St. Clair County providers have administered over 102,000 doses. In the county health department, over 201,000 doses. The county health department has administered 102,000 doses. About 97,500 were from the fairgrounds specifically. And we are closing on May 30th, will be our last day at the mass vaccination site. And then after that time, we'll be at 330 West Main. We'll continue to offer second doses there, as well as we'll be doing some mobile events. And then we have the other providers, the Walgreens, the Walmart, CVS in the area that's providing vaccine. We're hoping we're going to get a comprehensive list up, as I think both of the hospitals have kind of are downsizing their vaccine activities. Phil, do you have anything to add to that?
Nothing directly to add, but what was the date that you said that you're going to suspend the mass vax at the fairgrounds?
May 30th.
Okay, so May 30th, and then you're moving over to West Main. Okay, that's good to know.
West Main is already operating. It's been operating the entire time. We're offering Moderna and J&J at that location, and then predominantly Pfizer at the MassVac site. Right now, our first doses, we're seeing, anywhere from 80 to 150 first doses of Pfizer on any given day. So, 3 weeks out, that's kind of where we'll be. So we think that 330 can handle that traffic. Moving in, we can expand hours there. Now, we do have some media campaigns going out. There's been Gilbert Godfrey, Ozzie Smith, and then Brett Hall. They've had different celebrities out there advertising for people to go and get their final vaccine at the MassVac site. So we are trying to do a push. We're trying to attract those 16 to 18-year-olds right now. We're working with the 2 high schools to hopefully have clinics on site for them. And then that'll grow if we see the 13 or the 13 to 15-year-old age group added in. So we're hoping we do get a decent push to kind of round out some of those numbers within the county.
Great to hear that. What was your kind of what's your latest kind of throughput rate, at the MassVacs? What are you doing on first doses?
On first doses, anywhere from maybe 80 to 150 a day. Overall, we're probably averaging, 500 a day, depending on the day there. So
Wow.
We have seen a significant decline. It's under 1,000.
Wow. Okay. Yeah, I mean, going from pushing over 2,000 a day to that, that's a drastic decline. Any other local health departments? I know we got Terry on. I know we don't have Michelle on, but any other local health departments with any vaccine update data that they'd like to share? Okay. Any hospitals? I don't know if Sue jumped on. I know they just started their clinic recently. No. Okay. And lastly, in any of our EMS agencies have any vaccine information that they would like to share? I know John did just jump on, and Eric, I don't know if you, or excuse me, Greg, I don't know if you want to talk about it. Where are we at with our kind of, our EMS vaccination plan going out into the community?
Well, we have 2 now approved for homebound. I mean, we have 3 systems who can do it at clinics, EMS, and we have 2 that are able to do homebound. But I think St. Clair County and Madison might be able to speak more to how that's going. They do have approved plans, though, so they are able to participate with those health departments in getting those homebound folks done.
And this is Mila. We did get the approval, I think it was last week on that, but we've already administered first doses to all but maybe 4 in the county that we had on our registry. And so we will look at using those plans for potential second doses, but we're kind of in the lull period with that. So is John on for MedStar?
John, are you able? And
Yeah,
Mila,
I was having a little trouble getting unmuted there. Yeah. And you put me on camera too. Okay. Anyway, I'm looking a little rough, guys. It's inspection day for us. But anyway, what we've been doing until we got that plan put into play, we've been working with Mila in the health department, and they're sending out a nurse from the health department, and we're backing them up with an ambulance.
Thank
so
you,
we've
John.
been doing that. Yes, ma'am. I heard somebody say John.
I said, thank you, John. It's Mila.
Oh, yeah. Well, and now that we finally got the approval from the state, I'm hoping that we can take that off their hands, because they're busy enough. And I mean, of course, we're busy too, but if we can help in any way, that's what we've been trying to do. But so far, we've just been like a chase vehicle. Everywhere they go, we send a truck. We put an off-duty truck on, and we just follow them around until they get everybody that's on their list.
And Mila, was I correct in hearing you said you had all but 4 of the folks on your list taken care of? Is that correct?
That's correct. And those individuals, were, either in the hospital or had some other types of issues to where we weren't going to get to those 4. So like I said, at this point, we're looking back at going for second doses in the near future. And I'm going to coordinate with Nicholas out of Collinsville to see if he had any additional individuals on his registry. But those are all the folks that we had identified to us, either self-identified or through different agencies that we collected information for.
Very nice. That's great. Again, great to hear and great work. Collaboration and coordination, guys. Really start with work. Thank you so much. Okay. Well, we'll leave the vaccine stuff there. If you need any support, again, if you're deciding to start up a clinic, or if you need any, and potentially maybe using the EM track module for scheduling and all those type of things, and you need any help, my team here is open for that and any other type of throughput assistance that you may want to get set up. We're willing to help in any way we can. I know we have Sean on, and I don't think Dale jumped on. Sean, I don't want to put you in the hot seat, but I would ask if you've got a second, would you mind discussing what's going on currently regarding our pediatric and behavioral health needs on the other side of the river, which we were discussing yesterday? Do we made any updates, or do you want to give folks a kind of a situational awareness of what's going on?
Sure, Phil. So yesterday we received a call from St. Louis Children's, and they're surging, at capacity with behavioral health. They're really feeling the stress right now with the nursing staff. They've got patients in non-typical units just because they're taking and receiving so many behavioral health patients. So we had a SMOT call yesterday, and it sounds like we're feeling this across the region, which I'm sure you're feeling the same on the Illinois side. But we're looking at alternatives with EMS as far as trying to not load balance, but maybe just take the pressure off the Children's today, see if we can regroup and start load balancing some of these adolescent psych patients around the region with SSM and Mercy. I know our transfer centers have been speaking with one another, which is a good thing. But that's really it, Phil. We're all feeling the adolescent psych, I don't know if it's just the state of the world we live in today versus, the addition of all the COVID. I think some of the comments we're hearing are there's parents that are dropping these kids off because the parents are tired of dealing with them. And I think the at-home school has gotten to some of the kids. I'm open for any questions if anybody has anything.
Any questions for Sean?
Hey, it's John. I just want to agree with Sean. A lot of things that we're noticing when we're being called out to these residents. Just like Sean said, it sounds crazy, folks, but I'm telling you, it's out there. The parents are tired of the kids, tired of the ones that give them a little problems. So it's just as easy to shove them in the back of a truck and say, take them there. Just to let you know that we are working with our crews, not aversion or anything, to let them know that did y'all lose me?
Yeah, you're breaking up, John.
Yeah, you're coming in and out.
Hey,
Hi,
Phil.
this is Tina Hospital, and I was waiting for John, but we're finding a adolescent ED.
I'm sorry, say that again. Was that Tina?
Yes, what we're finding is a surge of adolescents in our ED over the last 3 weeks for the same reason.
Hey, Phil.
Yes. Is that Greg?
Sorry, I need to interrupt this program. I just got notification from the RSS that the shipment left at 9 o'clock. So those of you who are waiting to get that, I apologize that they just notified me of that, which means the shipment should probably be there 11:30 to 11:45.
Yes, thank you for that. And we will try to make sure that we are down there in time. So we have about an hour still. So thank you for that. So Tina was saying that she's experiencing the same thing, and that's as far as east as Fayette. And John, if you want to try again to finish up what you were saying.
Yeah, hopefully my Wi-Fi will hang in there. Yeah, I was just gonna let you know that we have talked with our crews and again, not on a diversion type of thing, but we're just trying to explain to some of these families, because 90% of them that we pick up below 157, which is that far western, East St. Louis, Coquia, Washington Park area, they are adamant about their kids going across the river. So we're trying to deter that to try to either bring them to Touche Memorial, just to kind of give a breather there. But I can tell you, MedStar itself, I don't know how many times or how many trips just since Monday where we've been up to Lincoln Prairie. We've been all over. I mean, we're trying to get these kids transported for everybody, but man, it's starting to take its toll because some of these, like Lincoln Prairie, that's a good 2.5 hour spin. We have run into a couple of problems with some of the children. Once we get into certain areas, we've had two where we've actually literally had to stop on the interstate and call ISP out because the child is trying to jump out of the truck. And when you're out in the middle of nowhere, you don't know where to go. So that's been interesting. But we are trying to work together and figure out some things. And we do let ISP know if we're doing long distance trips now, to try to get phone numbers that we can call when we get into a bind, like we were in a bind Monday with a couple of kids trying to jump out. So it's been interesting.
Well, thank you for that, John. And, for those of you who are dealing with those issues, we've seen it here at Memorial. We've had some behavioral health issues with, I'd say, not the typical behavioral health issues that we would experience in the past. And like you said, maybe it's a little cabin fever mixed in there. Not sure what it is, but we understand the limitations that we do have here on this side of the river. And unfortunately, whether through great marketing or otherwise, just the standard of care that has been kind of molded and shaped over the past 20 years here. I know the first thing that what John was speaking to, that a family says when they about to get in the back of the ambulance, take me to Children's, or that's what they get. And we're kind of seeing a kind of almost a little mini perfect storm of that. Hopefully it doesn't get any worse. And I'm not sure of what the next 15 years is going to entail, but some of the conversations we did have yesterday lead me to believe that maybe over, once this is all said and done, that some of the C-suite personnel across the region, both sides of the river, will kind of start to see the impacts of some of the choices we made over time, and where that leads us. And maybe we can be a little more solidified on this side of the river, so we don't have these type of events in the future. Never know what that's going to look like, but that's just me wishful thinking. So if anyone on here has ever been a teacher in the public school system or private, I thank you. You guys do a great job, and what you deal with every day, and the entire school system, to me, does a great job in maintaining and managing our kids. And sometimes, like you said, sometimes the parents are in a position where they're like, what do I do? And maybe not realizing what that's like. All right. So thank you, Sean, for giving us some feedback there, and hopefully looking forward to seeing how we kind of conquer this, and hopefully it doesn't spin too far out of control. So, all right, let's go ahead and move on. I'm going to actually bypass this slide because this isn't in the right order. I will come back to that one, but I'm going to go ahead and start off with our traditional format. So we're going to start with Greg. Any additional IDPH updates?
No, Phil, I really don't. Was just really kind of waiting this morning to hear when that shipment was going to leave. So other than that, I think you've covered the regional statistics and what's happening at the health department. So I don't have anything to add.
All right, sir. Thank you so much. I don't think, because Beth is not on, any of the health departments have any additional announcements that they'd like to make from a local health department perspective.
Phil, this is Mila. As most of
Yes.
everybody knows by now, Samantha Bierman's no longer with the health department, but we have hired a new emergency response manager, Kara Rosenkrantz. Kara, would you like to say hello to everybody?
Hello.
So welcome, Kara. We're getting her lined up with all the meetings and everything as it's moving forward. She was previously our Medical Reserve Corps person, and she's been out the fairgrounds since its inception. So she's a little bit familiar with our practices, and I think she'll be great in the position moving forward. So, but if anybody has any questions, you can reach out to me in the interim until we get her up and running.
Welcome here, and we're happy to have you. When I do get a chance to meet you, you will be presented with a coin, and hopefully, Mila, I'm sure you've got to have a coin if you don't have one now.
I do.
Okay, so she'll brief you on all that once we get a chance to meet face to face. So, welcome to the team.
Thank you. Thank you.
All right. Any other health department updates? Okay. Again, we didn't have unless Dale jumped on later. Any STARS updates? Nope. Okay. Mike is out doing inspections unless he jumped on and I didn't see him jump on. So I'm probably going to just attack Lee or Eric for a REMERT update.
Good morning, it's Lee. Not a whole lot on the REMERT front. We did last month, provide the medical coverage and support for the Go St. Louis Marathon. Actually, it went surprisingly well. We really didn't have to do a whole lot in terms of medical, but we did get a lot of interaction. So beyond that, not a lot to report.
Thanks, Lee. All right. And I don't think, let's see if Sue, I'm not sure if Sue jumped on. Oops. Okay, she has not, and I don't have any updates from Dana with regard to the mental health team. So
Hey, Phil, looks like Dale is saying he's able to speak.
Oh, okay. Dale.
Sorry, guys, too many windows and too many calls. Sorry, we were having a conversation with Missouri Hospital Association and Children's Hospital regarding pediatric mental behavioral health, and it sounds like I came in as y'all were having that same conversation. So appreciate the Hope Coalition's engagement with that phone call yesterday, and as we work forward, looks like, just for y'all's situational awareness, on the Missouri side, there is a psychiatric bed board that has already existed for a couple of years that we are going to utilize. We're, instead of doing a direct query, we're going to push out a notification of people creating updates to that board. It is on an 8-hour cycle, but and we don't anticipate people updating it every 8 hours, but it's one that's not utilized very often, and probably points of contact and access needs to be updated. But here's a great opportunity to do that. And so just for awareness, that's the path forward that we're moving, is to utilize a board that already exists, has the information in it. It's just a matter of making sure people are bringing it up because it has not been utilized. So hopefully that'll at least give us some data points. We anticipate 0 bed availability across the state for pediatric and limited to no availability for adults. But it does give that information and that data for executives to be able to make decisions in that process. So more to come. Unfortunately, no solid answers immediately, but path forward as we all work together on it. So appreciate it.
Thank you so much, Dale. All right. Okay. Just quick update with regard to grant status. I'm not sure. Georgia, did you receive anything yet back from, I know I'm poking on you first, but
No, I haven't gotten anything.
okay, so I will check. So hopefully, I mean, Christina's been working as fast as her tiny little fingers will will work, and she's burning at both ends with, we're about to have 3 concurrent grants for a Scotia. So she's been trying to get all that out as quickly as possible, and I appreciate everyone who has been providing updates and getting the information back as quickly as possible. If you do have anything outstanding, again, I will follow up today. I tried to do it yesterday. I was off Monday, was not able to do it yesterday, but I will follow up today with anyone who has any outstanding grant related documentation. And this is for the BP, I guess it's, Greg, correct me, I don't know if it's BP 2 or 1, but I'll just say the FY21 with the no cost extension that takes it out to January 2022. So some of you have, again, a lot of folks are complete, but I do know there are a few outstanding ones, and Georgia and the good folks at Chester are one of those organizations. Are there any other folks who did apply for FY21 but has not received their documentation back from the BJC GMO?
Eric.
Hey, okay, Eric, you haven't got anything back yet?
No, I mean, if I am complete, that would be great to know, because I was never told that.
Okay.
Last conversation, rather, emails I've had, and you were included in them.
Yep.
Were the fact that there was something I was supposed to be waiting on to execute the grant, and that's yet to be received. I sent you an email, I think probably Monday when you were off, to remind you that I haven't heard anything yet. So, okay.
Yep.
Yeah, this is Terry. Yeah, same situation. We were told we'd get something last Friday, and we haven't got anything.
Haven't got it. Okay. Thank you so much. And I will follow up today and hopefully have an answer. Hopefully today, maybe tomorrow, at the latest. All right. And just for the upcoming grant, I'll just say this: we have kind of reviewed the initial grant documentation, scope of work type stuff with IDPH, but as you can kind of imagine, this one is a little behind schedule, or a decent amount behind schedule. Last year, this time, we were well into potentially having, whatever grants almost finalized. But we're nowhere near that this year. So this one, I'm sure, will be delayed as well. And I can only just say, it's COVID related. So, all right. The supply chain integrity assessment. So this is some of the old business and stuff that we've been working on. I'll say this, that the information went out, the email went out, I know it went out to all the coalition members. Got about 61 views on it, but only 10 folks have submitted responses to that integrity assessment or the informational, just the survey itself. So we only got 10 submissions, of which I think 6 were hospitals, 2 were public health departments, and 2 were EMS agencies. So really, really need your feedback on this. And it's not very in depth. It doesn't take probably a very long time to fill out. Just going top to bottom through that survey. But some of the answers, you may need to get a little bit of corporate knowledge, especially if you hadn't been in the position for a long time and you want to have those answers answered correctly. So I'm keeping it out there, and we'll keep the form open until the 31st. The goal was to have it closed on, I think, the 12th of this month, which would be next Wednesday. But since we haven't got a ton of responses back, I've pushed that out to the 31st. So please, if you have not completed that survey, please do so. It will help us out tremendously in the end. It's one stepping stone in better understanding the supply chain nature of business as it is across all of the healthcare entities and our EMA partners, health departments, et cetera. So very important that you guys fill that out. All right. I'll go with our regional COVID-19 AAR. All right, our after actions report. I think it may be 100% now. I was hoping it would be done before this meeting, but I just got a note that most of this had been completed. But we put together an AAR survey, and the goal is to get that open on no later than the 12th. I think now with the last version I just reviewed, we may be able to go live before the end of the week. So please be on the lookout for it. We're going to do this in 2 parts, so there'll be some information to talk about. So you're basically going to be filling out basically the exact same survey in 2 different parts. You're going to have one that covers the January to June, so the first 6 months of last year. And then July to December of this past year. Okay, and the survey, again, this won't be very hard. There'll probably be a lot of check marks of, this was very effective, somewhat effective, not effective at all. But it should give us a good insight as to how we as a region worked with coordination, response, communication, and those type of things. We're not going to be able to, the survey is not going to drill down into specifics on this day at this time. It will not be in those type of talking points, or bullet points or anything like that. It will be general in nature, but it will be specific to our region. So I think there's about maybe 15, 16 questions on there at the maximum, maybe less than that, but there's a lot of spots to answer. So I will send out a printed PDF copy of it, so you guys can just sit down at the desk or have your team maybe sit around and just run through it and fill it out before you have to go up on the survey. It'll be a SurveyMonkey website, and fill out the information. So it should be fairly simple, but it will cover 2 time portions. What we did, again, very beginning to the middle of last year, and then middle of last year to the end of the year. Okay.
Phil, real quick, this
Yes,
is Eric. I just wanted to share, and not, I assume a lot of people have probably done this, but just share what we did about halfway through, well, what is halfway through the COVID so far, I don't know, but a number of months ago, we basically did a SWOT analysis, and it was actually before our last big surge. And then we reviewed that same SWOT analysis about 2 months ago. And basically that's what we've been trying to do, is see, what we've done better, and continue to improve. And that was very, very helpful. And if anybody wants any ideas on a SWOT analysis for COVID, I think I stole it off of the Asper Tracy website. So it was a very good tool to use. Basically rating yourself on all the things you could have been doing or should have been doing along with COVID. But I know my emergency preparedness committee found it very helpful.
Awesome. Yes. Eric, if you wouldn't mind sending that out to me, and then when I send out the link to the recording, I will just package all that up and push it out to the entire region. All right. So again, your support in filling this out, again, it'll be from a regional perspective. It won't be from specifically an organizational perspective, although it may ask you some organizational questions, like how effective was your organization at fill in the blank doing this, and just on a sliding scale. So, all right. We'll pause here for a quick, not pause, but we'll kind of transition. I'm going to have Lee, I know Eric is on as well. Eric Perham is on as well. I'm going to have Lee kind of talk about our mystery patient drill that we ran and what we're looking to do with regard to an exercise that we just conducted the other day, and what kind of some of our goals were. So Lee, if you're on.
Yep. All right. Again, good morning, everyone. So yeah, what we did, we decided to do a high consequence infectious disease drill at our Memorial East campus. Eric and I worked on this for a couple of weeks prior to actually pulling the trigger, and in turn learned a few things. The premise of our exercise was to have a pediatric patient with a set of symptoms that could be a few things. show up with a parent that does not speak English. We actually utilized Eric's family because his wife speaks Korean and gave him a little bit of a workout. During this, we treated this as if it was a legit real incident. So we didn't follow them around. We stayed into the shadows and watched what happened. And overall, the exercise went remarkably well from the time that the patient presented through the time that the patient would have been arranged for transport to the closest assessment hospital was give or take about 40 minutes. It was a rapid process. That wasn't to say they'd be moving in 40 minutes, but they had that plan in place and resources requested and things of that nature. Greg will attest, I actually had to call him to say, please figure out who they're calling as the EAH and let them know this is a drill, because they went so much quicker than we anticipated. The doc was on the phone with them before we could say this is a drill. It was a sight to see. What our goal is going to be for this, we've developed a pretty straightforward exercise plan template that we can send out, and we will send it out to everybody, that you can utilize this inside your own campus. And this isn't just for Ebola. That is what we opted to do for this one. However, this works for any of your high consequence pathogens. So if you wanted to do measles or, you pick it, it's an option that you can easily, find, replace, and insert the appropriate disease. The point of it is that we want to get back to a point regionally where our plan is up to date. We're currently working as a grant deliverable. We have to have a regional HCID plan or Ebola plan, however you want to look at it. And so we're working to update that. We're also working to ensure that we, again, have these exercises available for everyone. We're going to do a tabletop exercise towards the fall that will be It basically will give you the opportunity to run a tabletop in your campus the same time we're running one as a region. We'll kind of guide the conversation from our side, but we encourage you to have your infection preventionists, your infectious disease doc, your ED, the folks that would actually be involved with that. And for the EMS folks, John and Jeremy and Kim and all the folks on the EMS side of the house, we really, really would like to have you involved in this as well, because there is a lot that's going to be very unique for you guys. The date for that will be forthcoming. We're still in the early stages of building out the exercise and getting everything lined out. Part of that is dependent upon having our updated regional plan, because that's what we want to exercise. We do want to point out this does, for those that are EDAP or SEDP, this does kind of help to meet the requirement for the exercise, because we do utilize, or at least we did for ours, for the mystery patient, we did utilize a pediatric patient, which did complicate things. And we encourage you to look at that as different options for it. When we get to the tabletop, post-tabletop, after we've done the updates and reviews from that, we are going to try to do a actual patient movement drill, moving a patient, whether it's a mannequin or a live role player at this point, is to be determined, but from one of the coalition facilities to the appropriate facility for an assessment hospital. Meaning EMS will go through the whole start to finish, putting your plastic up, possibly using the isopod, depending upon the nature, in case, it'll all be there. The current EMS provider that, we have on the books for that would be MedStar. That's the one who's, previously been built into our plan. So John, we'll definitely be in contact with you to make sure everything's up to date and that we have all the resources in play. But we would encourage that all EMS providers participate in this, since, if we end up with more than one patient that has to be moved, or something happens and they're unable to do it at the time because, I don't know, maybe we're in the middle of a major surge or a pandemic, that could be something we need to address. Again, the dates for that will be after the tabletop, and the tabletop won't be until probably early fall. But that's kind of where we're at with it. I will, as soon as we get the documentation finished, I will send out the exercise template, and we can always do a little workshop on it if you'd like, to help you to build those out so that you have it. It is all done in the HC, the Homeland Security Exercise and Evaluation Program. It is built in that template, so it will meet all of your Joint Commission or HFAP requirements. And you can make it as complex or as simplistic as you desire. I think that's all I've got. Eric, would you like to chime in? I know, again, you were heavily involved in this whole process.
Sure. So one of the things that I'd like to just touch on when it comes to the patient itself. So how did we get a 13-year-old child into an ER without having people stand around and pretend like this is a drill? So what we utilized was, or actually what we used, not utilized, but used was actual moulage. So we moulaged up the patient consistent with what we saw with Ebola. So, we had, we used moulage blood for coming from the eyes and from the mouth, a very close representation of a rash that you would normally see with Ebola. And so this is, since we found out how effective that was, where we actually were, surprised at how the hospital staff treated it, is that they didn't know if it was moulage or real, so they just went down the real route, which helped us get a better assessment of the healthcare team between the doctors and the nurses and the hospital staff. So what Mike Gilbert and I are looking at currently right now, regionally too, is bringing in a moulage expert to help us, not only because trauma is fairly easy, but the actual clinical moulage is a little more difficult because we have to have a sense of realism that tells a story that we as, operator controllers or people who stand off to the side don't have to explain to the staff so they can respond naturally. So that's something that now that we've kind of done this the first time and realize how powerful moulage is, we're going to start bringing an expert into the area to help train us to do more clinical style moulage to help with these drills. So in the future, when you're looking at these templates and you want to, put some exercise together, not only can we do that, but we can actually help you moulage a patient that you may want to try to present to whatever department so they can see how they respond. So that's something else that we're looking at. That's all I have.
Phil, this is, or Phil, everybody, this is Dale. BJH, a couple of years ago, as part of the Ebola assessment program that they were a part of, ran EMS drills. And Lee, you mentioned that. I'm sure that you either watched, I don't know if you watched them or not, but they brought in folks from all over the state because those EMS people from outstate needed to recognize how to run that with BJH. And so each EMS department came in and did that. Most of them even did it twice because they brought 2 crews with them in one unit just so that they could run all of that. And then also too, as part of that program, one of our transport EMS agencies, when they did the full scale up to Iowa transport, we also invested in some monitors so that they could monitor like oxygen intake and temperature and all that of both the patient in the isopod as well as the unit itself, the ambulance unit during that long trek. So, if there's any of those after actions, resources, comments, thoughts that we can provide from our side as you move forward on that, please feel free to ask and we'll provide whatever we can. Clearly BJH, the assessment hospital, and y'all's, you're part of that system. So, access to that should not be a problem for you, but anything that we could help from any of our EMS partners across the state, because some of them were very small EMS departments that came in and ran that. And I observed a lot of those, and the differences in what they came in with were significant, but also taught everybody a lot of information. So anything we can do to help, please let us know. This looks like a really cool exercise. I think we're going to have to copy it on our side.
Thank you so much, Dale, for offering that type of assistance. And yeah, we have deliverables we want to get done, but the big thing with it is that we want to provide something that's realistic and achievable for us to accomplish here and gain some knowledge and wisdom. So anything you'd be able to share would be great. And when we do go to set this up, the more folks that we can have involved in this only helps out. On our IDPH call I had last week, where we reviewed the Ebola annex for the state, we did have the good folks at Carl who were kind of our go-tos for some of the planning purposes, PPE, training, education. When I say Carl, I'm talking about the healthcare system up in Urbana or up in Champaign area. They are also a great resource that we're probably going to try to have them involved when we accomplish this as well. There were a few things that I will say that, with an HSID, I'll just say an Ebola patient, that a lot of our docs and our frontline staff don't realize. First thing that they do is they try to do everything that's just by the books of day-to-day business. But once we really identify someone who may have one of, and I'll say specifically Ebola, things change quite. They're not the same protocols that we would use. And I'm not just talking about the ambulance and how it looks and how we transport that individual, as to where they go, how they get where they're going to go, et cetera. Those things are, kind of taken out of the normal day-to-day processes. So good eye-opening experience for us here just locally, and hopefully when we do this on a larger scale, we'll be able to provide that type of feedback and lessons learned for everyone. Again, we don't know when we're going to be able to do a full-scale exercise again the way we were trying to. Hopefully we're going to put it in our budget to be able to knock it out in the next fiscal year with those grant funds. But if we can't, we do see a lot of value added. Even though this is a checkbox requirement for the grant, we do see some value added in running this type of exercise or drill. So I'm going to pause there. Any questions for Lee, Eric, or Dale? Okay, no questions for the crew. Then I will open the floor for any questions, concerns, needs. And we'll pause right here for a little bit. Okay, no questions. Let's take a look at upcoming events. Again, the regional AAR, we were looking to open it up by the 10th, which I think is next Monday. We may be able to open that up sooner. So be on the lookout for that probably in the next day or so. Probably before Friday, you'll receive a link for that. I'll leave it open for basically 30 days for you guys to fill out. I promise you it won't take you 30 days to accomplish. It probably will take you, after you read it, if you read that PDF of the questions, it'll probably take you maybe 20, 30 minutes, filling out the PDF and doing the survey. I would recommend that, as a part of maybe a team huddle or leadership huddle, that you include some of your key partners in the organization to assist you. So we're looking at some of your managerial positions that are probably really involved in the entire COVID response. A lot of it will relate back to how did that occur regionally, but there are some kind of slightly more specific things that they may be able to answer, but you're probably going to be the subject matter expert overall, and your input is going to be very valuable in that. We're still on the holding pattern with our decon training. I probably should have gave an update. We are de-winterizing the trailer today. So if we do get in a position where we're able to do some of those decon classes, we may do them hybrid, where we do some of it either online or in person with a smaller group, and then doing the hands-on portion outside with that decon trailer. So that way we kind of keep our social distancing and all of the things that we need. Good thing about doing the hands-on part is everybody's going to be in PPE anyway, so no real risk of transferring any COVID or any other HSID that may be out there. Things on the horizon: National Healthcare Coalition Preparedness Conference is currently scheduled for November 30th through December 2nd down in Orlando, Florida. So I recommend those folks, if you did put some coalition money in, or if you just want to go on your own, that's something that's, COVID pending is a great opportunity to participate in. Again, down in Orlando, Florida, November 30th. And the IAM conference is in Grand Rapids, again, Michigan, as it was maybe 2 years ago. Hopefully better weather this time. So that's the International Association of Emergency Managers Conference, 15 to 22 October. And I normally attend the healthcare caucus on the pre-side of that, which is fairly good. It's been growing year after year, and I'm sure this year, COVID pending, we'll probably have a good attendance rate. If not, definitely will be virtual. So that is going on. Both of those links work to get you to their registration pages, and some of them are not open for registration, but at least the informational pages that are out there. So last chance for any questions, concerns. Okay, there are no further questions or concerns. We're going to close it out here, and we will see you again for our monthly coalition conference call next month. That's going to be on the first Wednesday. So in my good old birthday month. So June 2nd is our next meeting. We'll see you there. Again, as a reminder, there is no coalition hospital pulse check this afternoon at 1. That is not occurring since we have this meeting. And I guess in about 30 minutes or so, we should have some vaccine to redistribute here for the health department. So I will talk to you sooner. Ciao.